Overview for sickle cell disease, a lot of the time is typically seen and isolated to mainly people of African American descent. So sickle cell disease, as we all know, is a genetic black disorder, right? Whereby you have these sickle cells blocking these vessels and ultimately causing pain and other complications in this patient population. As we learn more about the disease and as we do more research about the disease, it is actually not specific to one demographic, and so it actually can occur irrespective of the race or ethnicity of a specific patient, even though some ethnicities are more likely to get it. What's interesting about sickle cell disease now is with all these different complications that come with sickle cell disease, like acute chest syndrome, pain crisis, and people having problems with their spleen, we have opportunities to target all these different complications by using different therapies. As far as we know, so mostly kids are typically put on penicillin as a prophylaxis for not being able to have a spleen to kind of protect as an immune support for them. But now, with all these different research being done for sickle cell disease, we can target all these specific complications and make sure each patient is individualized and they can take care of themselves, whatever therapy they decide to go on. So I think that's an exciting news, and it's good that we have a lot of conversation around sickle cell disease now, but it's also good that the medical community also pays attention to what the patients are saying and also use that input to kind of influence their research so that when the treatments are available, we know they came from the patients with the support of these researchers too. So my group, Sickle Cell 101, was founded by a girl who actually has sickle cell disease, Cassandra Trimnell. Cassandra is a founder and executive director, and she's done a great job putting this organization together. On our team, we have people from different backgrounds, so like from people with medical backgrounds and people with other different experiences too. And for what our mission is just making sure we can take good care of the patients. We do advocacy work. We also make sure we interact properly with researchers, both academic and even non-academic as well, and also make sure the patient voice is being heard, even in pharmaceutical organizations too, so they can actually value patient input, whether it's for a clinical trial or it's even for a journal survey or a journal study. So making sure that patient voice is being heard in all of these different stages, that's kind of what we try to emphasize on as a group.